as everyone starts to trickle in. All right. Hello, everybody. Good evening. Thank you so much for joining us this evening. I hope none of you are as sad as I am. I am an avid Blue Jay fan, so that was a tough Saturday, but nonetheless, I'm happy to be here to talk about respiratory therapy. So my name is Jason DeMano, and I'm the student recruitment officer here at the Michener Institute. Essentially, my job is to promote Michener and its unique programs. So you might see me at maybe a high school fair. You might see us on webinars such as this, Ask Me sessions, or even if you do a walk-in with us. So if we met before, nice to see you again. If we haven't met, well, nice to meet you. And joining me today are two lovely people. We have Cherry. She is the student recruitment coordinator, and I work closely with her. And we also have a student from the respiratory therapy program, Taylor, and she's going to be sharing her experience and expertise and kind of what it's like to be a respiratory therapy student at the Michener Institutes. Without further ado, we will begin our webinar. We'll start off with the landing acknowledgements. The sacred land on which the Michener Institute operates on has been and continues to be the traditional territory of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, among many other unnamed recognized indigenous communities. Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and the Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibility of taking care of this land and transforming our personal and institutional relationships. We acknowledge that this is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's 7 health-related recommendations. Now, what is respiratory therapy? So for those of you who are not too sure what it is a healthcare specialty that focuses on helping patients with breathing difficulties and lung conditions. So these are people that may be in all stages of life. They could be at the beginning of their lives, maybe midlife, or even close to their end of life. And you can find respiratory therapists working in many areas. They could be working in the ICU, maybe in the ER as well. And essentially, they are the ones who administer oxygen. And even, for example, if someone needs to have CPR done to them, then they need to be resuscitated. Respiratory therapists could also be a part of that, giving them oxygen to help them breathe again and also get them stabilized as well. And they can also use not only the oxygen mask, but also ventilators, um, also use oxygen therapy and other many techniques. Now, we're going to turn it over to our guest speaker, Taylor, who will kind of talk about what it's like to be a part of this amazing program. So, Taylor, thank you so much for joining us here this evening. We know it's a busy schedule that you have, but we really appreciate the time. So, as a respiratory therapy student at the Michener Institute, what does your typical day look like for you?
Yeah, absolutely. Thank you so much for having me here. I am in my third year of the respiratory therapy program here at Michener. A typical day might look a little bit different depending on what semester you're in. So we do semesters very similar to any university college would. Um, in your first year, you might be expecting to do classes that are more foundational, a lot more like background sciencey, get all of the physical principles down. So in that semester, the classes are actually all online. So it's really nice if you do commute. It's one of the things that actually drew me to applying to Michener because I live in Durham region. So getting to do the bulk of my classes from home allows me to work a little bit, spend less time on the GO train, which I am spending lots of time on that right now. But I really liked the appeal of online classes. But you also do have the hands-on experience of labs too. So I did not feel like I was missing out on any hands-on experience because twice a week you're still going to school. You have a full day there getting to put into practice everything you learned in lecture. You get to actually see all of the equipment right from the very first week of being a Michener student. You're doing those labs. So it's honestly a great format that they have. It is very helpful for the students, but also the faculty. So that's kind of the typical day of a first year student. Same thing pulling into second semester of first year. You're getting just more now into the bulk of respiratory therapy, caring for patients and some lung pathology. Um, the summer is off for the semester in between first and second year. And then second year, you have another 2 semesters of that hybrid classes and labs. Something that I'm kind of pulling into the second question now here, my favorite part of the program, I would honestly say it was the summer between second and third year because we do a whole simulation. I think it's 10 to 12 weeks of this, and the whole school is kind of converted into this simulated hospital environment. We have very high fidelity mannequins there that they can breathe on their own. Our professor can manipulate all of the vitals of this mannequin. So you really get to see what going into clinical might look like. It just makes you a little bit more comfortable speaking in front of people, speaking in front of your professors who might be the physician or the family. You're talking to the mannequin can actually talk back to you. Um, they can blink and breathe and do a lot of what a regular patient would. And you are really practicing the group dynamic with your peers on how you're going to enter the room, how you see the patient, help diagnose the patient, and then treat the patient. So it's really a great, wholesome experience. And not every college does this simulation semester. And honestly, it made such a difference going into my clinical. I feel so much more confident. So I think that is definitely my favorite part of the program. Interests me the most just about respiratory therapy in general. A little backstory on how I found respiratory therapy, because honestly, not a lot of people know what this career even is. I was in my fourth year of university. I wasn't necessarily sure what route I was going to go. I had so many people telling me to go the nursing route, and I did consider it. I won't lie. I was kind of going between respiratory therapy and nursing. Um, However, I love the flexibility and the variability of patients that you do get to see even in a single day. It kind of depends on the hospital that you work at, but you could be attending a delivery of a newborn baby and helping that baby breathe for the very first time in the morning. And then in the afternoon, you're going to the ICU and you're seeing somebody who is on life support, and you get to play a role in helping them get better or helping them at the end of life make sure that they are comfortable. And it's super rewarding to get to be with the family and make them as comfortable as possible during that time of their life. We are in the emergency room for any traumas that come in. We are in the operating room. So it's so much variability, and I love that not every day is the same. Something that I really like about respiratory therapy as well is it's very technical. We deal with a lot of equipment, and we are highly respected within the hospital setting to help troubleshoot that equipment. And it's nice to know how respected we are in that sense. We also, too, if critical care, this is a critical care webinar, but if it turns out to not be for you, respiratory therapy, there's many avenues outside of working in a hospital. You can work in pulmonary function labs. You can work in home oxygen companies. There's plenty of other avenues. You can go up into management. You don't have to be bedside for your entire career. So there's lots of different direction. And Michener does a great job at preparing you for all of those avenues. We are not just focused on being in the ICU, being in the ER. We're focused on all of that. So you really get to, while you're in school, you can kind of get a feel for what might interest you and your placement. Another solid thing about going to Michener is the clinical placements are all placed for you. You don't have to worry about finding your own, and they are all very local to where you live, where the downtown area is, and you, again, the versatility. So for the last 3 weeks, I've been in the neonatal ICU. We go everywhere for clinical placement. So again, you get a taste to see exactly what you want to do after you graduate. Some admission tips. I would say there's the component of your GPA. So continue to work hard in your studies now. Really show off for those final exams coming up shortly, and try to do the best you can for your GPA. But another component to the application process for respiratory therapy is a Casper test, which is an online test that is less knowledge based and more application, how you're going to react to certain scenarios. Um, Studying for that test is not mandatory because it's more like ethical dilemmas and kind of in a group setting, how would you manage conflict, those kinds of questions. However, if I can give one piece of advice for that, I would say definitely do the online practice questions, even though it says you don't have to study for it. Um, Obviously, you want to answer how you as a person would answer. However, I found, and reluctantly, I should have done more of these practice questions because you just get a better idea of formatting and how they, like a answer structure. It just helps when you're on a time crunch, kind of formulate all your ideas and get them organized for the answer that they want. So those are all my tips. If you guys have any questions at all, please feel free, put them in the chat, and I'm happy to answer.
Thank you so much, Taylor, for sharing all that. Definitely some amazing advice and amazing experience that you have from the program and also what's to come as well. So we really appreciate
Mhm.
that. Now for the fun part, the Q&A part, I'm gonna let Cherry take over and facilitate this. If you do have any questions, please put them in the Q&A box and we'll get to it. So Cherry, over to you now.
Thanks, Jason, Taylor. So we do have a few more minutes to answer questions. Please make sure you put your questions in the Q&A section. We have a question saying, I've learned that some RTs later pursue further specialization, such as cardiovascular perfusion. For graduates of the RT Advanced Diploma Program, what would be the typical pathway if they wanted to apply to the cardiovascular perfusion program in the future? For example, would they need to complete a Bachelor of Science first, or is advanced diploma and clinical experience already enough? So for our respiratory therapy program, we require minimum of high school OSSD transcript, as long as your minimum overall grade 12 average of 75% with prerequisite courses like English, math, chemistry, and biology and physics, you'll be eligible to apply. Make sure you check our website for admissions requirement because it lists out all the details of the percentages that you need. And if you're applying with a post-secondary education, you'll need to provide the transcript as well. And we assess in your favor. So if you completed both your high school and your undergrad studies, make sure you submit both of them, and we'll take the prerequisite courses with the higher score. So we assess in your favor. Another question is, what was Taylor's undergrad? So Taylor, over to you.
Yeah, so I personally did my undergrad in a general biological sciences program. I see another question here. I'm going to rope both questions into the same answer, and it is, have I noticed any colleagues without a science background? I would say majority do, but it's absolutely doesn't mean that you can't still apply and you won't be considered. I have a lot of colleagues that have their undergrads in kinesiology. That's a very popular pathway into RT. A lot of pre-med biological sciences too. But uh, please apply anyway because you don't. It's not a requirement to have a biological science degree.
Thanks, Taylor. So I also see a question asking about non-science background applicants. So we do have applicants who have a non-science background applying with their high school transcript or with their undergrad studies, as long as you meet the requirement of the prerequisite courses and also the GPA and CGPA, you'll be eligible to apply. We only assess according to your CGPA and also your GPA of the prerequisite courses. And also CASPER score, which is one of the component of assessment. We don't assess other volunteering experience or reference letter or anything like that in that sense. But like I mentioned, we do value your scores. So make sure if you don't have a science background, but you meet all the requirements, make sure you submit all the necessary documents, your undergrad and graduate studies if you haven't, and then make sure the score is meeting our minimum requirement. And if you did not score well in your CGPA or GPA of the prerequisite courses, what you can do is you can score higher in CASPER score to balance it out. So I also see another question for those seeking volunteering experience. For application, like I mentioned, we don't take other experience into consideration, but just the grades and the CASPER score. We do have high school students getting into the program, but most of our applicants have a bachelor in their application. So I wouldn't say that high school students can't get in, but it really depends on the pool of candidates that year, depending on the competition. But most of our applicants have an undergrad degree. What was the most challenging part of the program? So I believe Taylor, you can answer.
Yeah, sure. I think the most challenging part of the program for me was shifting the mindset from a university background where you cram for the exam and then as soon as you write the exam, you can forget everything you ever learned about a class. And that is just not a program and a career that we can do that with. So it's taking everything that you learn from the first week of first year and building upon that. So I did struggle a little bit at first because it does take a lot of recall of as to what you learned the previous year. But yeah, I would say academically, I struggled a little bit more in respiratory therapy than I did my undergrad. It is a tough program, but it's definitely manageable. Find some study buddies and just work hard at it.
Thanks, Taylor. I'll answer to one last question regarding prerequisite courses. So if you did not meet any one of the prerequisite courses, you need to make sure you take those courses in a recognized university. As mentioned, respiratory therapy requires English, math, chemistry, biology, and physics, and one additional grade 12 university level course. So make sure you take, if you don't have physics as your prerequisite in your transcript, make sure you take that in another education institution to make up for that. And then you'll submit the transcript over to us for assessment. With that being said, we have a lot of other series of our Michener Monday webinar. If you're interested in all our other programs besides of respiratory therapy, make sure you check out our website. We also have Ask Me session every Friday as a drop-in session at 1 to 2. We have our admission officers and recruitment officers there to answer your questions and look more in-depth into your situation. So we do consultation in those drop-in sessions. Feel free to register on our website. If you have any general questions, feel free to call us. The phone line operates Tuesday to Thursday. And if you want us to kind of like look over your transcript, we do consultation. If you want to know if your transcript meets those prerequisites, feel free to send it over to admissions@michener.ca, and our admission officers is gonna provide you suggestions or answer your questions. And this brings us towards the end of our webinar session. Thank you all for joining. This will be recorded and uploaded onto our website. So in case you want to refer to that, feel free to check out our website. And one last reminder, we have an open house event on November 22nd. It's from 10 to 2 p.m. The registration link is already posted on our events page. So feel free to go onto our website and check that out and register to come talk to faculty members, students, alumni, student ambassadors to get to know more about the program and tour around our campus. And yeah, thank you everyone for joining today's session. We look forward to seeing you in our future events. Thanks everyone.
Take care, everyone. Have a wonderful evening.